You've heard of vitamin D supplementation, but is there something as too much vitamin D? And the answer to that is yes. There is something called vitamin D toxicity or hypervitaminosis D. And this happens when you have excess vitamin D in the system, not through diet and not through sun exposure. This is usually happening in autoimmune patients because the resistance to vitamin D is less and therefore they need to be given higher and higher doses of vitamin D. What you need to know is that calcium is dumped into your bloodstream, and there is a fear that it will move towards the kidneys, coronary arteries, and blood vessels. And this is what the doctor who works with you on supplementing your vitamin D should know how to handle. To support the synthesis of vitamin D, your doctor needs to help you with supplementation. And here's what you should know: selenium, K2 to help move that calcium away from the heart and the coronary arteries and the kidneys, zinc, magnesium, and omega-3 fatty acids. These are important while you're on a high supplementation of vitamin D. What you also need to know is you do not need to be on calcium supplements at this time. And also keep checking your parathyroid levels because that's going to go down. And very often it's been said that it reaches normal levels. I've actually seen patients go into a hypothyroid condition because of excessive levels of vitamin D. So you need to be very closely working with your doctor who's monitoring you on all your labs and also checking your thyroid levels all the time. I always recommend that in the end there are always alternative approaches and nothing like Ayurveda to help you. And if you find a good practitioner, you might be able to find a better alternative working with autoimmune disease.